Before starting that, let's read this quote. The quote is, hard work can beat genetics and talent. Okay, so if you are a mediocre student, then don't worry, this is the option for you to score 260. Okay, hard work. So let's start the discussion. First, remember a general rule. The rule is that GIT hormones, they are first secreted into portal circulation. From there they go to systemic circulation, and from systemic circulation they reach the target cells. Okay, so this is a general rule which you need to remember. So okay, I have divided the whole physiology into 3 parts. Okay, means the GIT hormones which are secreted into 3 parts. Okay, so we will discuss all the parts one by one, and that will make it a little bit more easier. So in first part I have compared gastrin with gastric acid. Okay, this is often confusing because gastrin, gastric acid, their regulation, their source, that might be confusing. So first we will compare both of them, and hopefully that will help you to remember it in a better way. So let's start with gastrin. What is the source of release of gastrin? It is the G cell. And where are G cells located? They are located in the antrum of the stomach and duodenum. Okay, what is the source of HCl? That is parietal cell. And where are they located? That's body of stomach. So compare this. Their G cells are located in the antrum of stomach, while HCl is located in the body of the stomach. So having said that, let's move on to the factors that regulate the release of gastrin and HCl. The factors that increases the release of gastrin, they are first stomach distension, alkalinization, vagal stimulation, amino acid and peptides. Now we will go into detail one by one how it occurs. See, the first thing is stomach distension, and you don't need to know the exact mechanism how it works. Okay, so just remember it's due to stomach distension. The second one is alkalinization. Now the main aim of gastrin is to increase the HCl, that will decrease the pH. Okay, so whenever there is decrease in pH, gastrin will be inhibited, and vice versa. Whenever there is increase in pH, the gastrin will be increased. This is very similar to the feedback mechanism which we see in the endocrine system. Okay, so remember that alkalinization will cause increase in the gastrin production. The classic chronic use of proton pump inhibitor that leads to alkalinization. The third one is vagal stimulation. Okay, any hormone that helps in digestion, see here I have already written it, any hormone that increases the digestion, its production will be increased by the vagus nerve, and any hormone which decreases the digestion, for example somatostatin, its production will be inhibited by the vagus nerve. This doesn't apply to all the hormone, but most of the hormones. So see, the main thing that you should remember about vagal stimulation is GRP. Most of the students, they think that vagal nerve, it causes increase in the gastrin production through acetylcholine, but the answer is it increases the gastrin production through GRP, that is gastrin releasing peptide. So remember that. And the last thing is amino acid and peptides. Okay, the gastrin will cause increase in the hydrochloric acid release. Okay, increase in the release of HCl to cause the main aim of increasing the HCl is to increase the digestion of proteins. So whenever there is amino acid or peptides in the stomach, that will cause increase in the gastrin production. Okay, we already said about decrease in the pH will cause decrease in the gastrin production. Now there is one thing is gastrin production increase in chronic atrophic gastritis by H. pylori. Now how does this happen? Let's discuss that. Let's see. H. pylori, it destroys the D cells, and when it destroys the D cell, there is decrease in production of somatostatin, and whenever somatostatin decreases, the production of gastrin increases. So this is the mechanism by which H. pylori causes increase in the gastrin production. Now let's move on to HCl. Okay, the 3 main substances which causes increase in HCl production are histamine, acetylcholine and gastrin. Okay, and I have put 5 stars in this topic because see, there are 2 reasons why these 3 substances are important. First is the use of secondary messengers. Okay, secondary messenger are one of the highest yield thing for USMLE step 1. So definitely remember that. Okay, which are the secondary messenger used by gastrin and acid? Gastrin use means they work through GQ. Okay, while histamine works, just a second, oh, sorry, while histamine works through GS. Okay, so definitely remember that, and from GS it causes increase in the cyclic AMP, while GQ, from GQ there is increase in IP3 and calcium. Okay, so definitely remember that this is one of the highest yield things. Another thing is its connection with the pharmacology. All the drugs which decreases the acidity, they work through mostly through these 3 substances. Now the substances which decrease the production of HCl, they are prostaglandin, somatostatin, GIP and secretin. See, the main goal of secretin is to increase pH. To increase the pH, then definitely it should decrease the production of HCl. Now prostaglandin and somatostatin, both of them work through G inhibitory protein. Okay, and that will cause decrease in the cyclic AMP, and this will result in decrease in the HCl production by inhibiting the H plus potassium ATPase pump. Cholecystokinin and secretin. Okay, the source of secretion of cholecystokinin is I cell, and the secretin is released by the S cell, and secretin is one of those very important hormones. Okay, so do remember them, do remember secretin without fail. Now we will discuss the effect of cholecystokinin and secretin on stomach, then on liver and gallbladder, and then on pancreas, and I hope this will make it a little bit simpler. So first let's discuss the effect of cholecystokinin and secretin on stomach. The cholecystokinin will cause decrease in the gastric emptying, okay, and the secretin will decrease the gastric secretions. So that's the effect of cholecystokinin and secretin on stomach. Now let's discuss their effect on liver and gallbladder. In liver, secretin will increase the bile production, okay, while in gallbladder, on gallbladder the cholecystokinin will work and it will cause gallbladder contraction. Also cholecystokinin will cause relaxation of sphincter of Oddi. So when cholecystokinin causes gallbladder contraction and relaxation of the sphincter of Oddi, both of them will help the bile to reach the duodenum. So that's the effect of secretin and cholecystokinin on the liver. Now the third effect is on the pancreas. Okay, the cholecystokinin, it will work on the pancreas and it will cause secretion of thick fluid which will be rich in the enzymes. Okay, while secretin will work on the pancreas and it will cause release of watery fluid which will be more rich in the bicarbonate. Okay, because the main goal of secretin is to increase the pH in the duodenum. So these were the effects of cholecystokinin and secretin on stomach, liver and pancreas. Okay, now let's just a second. Another thing is that secretin works on the ductal cells of pancreas, okay, while cholecystokinin works on the acinar cells of the pancreas. Okay, so remember that. Now the rest of the hormones, 4 hormones which I will discuss, which are important. Okay, rest of other like the bicarbonate secretion or pepsin secretion, that will be easier for you to remember, so we will not go into discussion of those things. So let's start with GIP. The 3 points that we need to remember about GIP is, okay, diabetics they should like GIP, okay, because it causes increase in the insulin production. The another point is that GIP is the only hormone in the GI tract whose secretion is regulated by carbs, fatty acids as well as protein. It is the only hormone which is regulated by all three macronutrients. Okay, so remember that. The third thing is under effect of GIP. Under effect of GIP, the glucose increases. Insulin increases very rapidly. So this is another very good question for step 1. Is that when we give IV insulin, IV glucose and oral glucose, which one will cause increase in the insulin production? And the answer is oral glucose, because oral glucose, it stimulates GIP. Okay, the next one is VIP. Okay, the three things that you should know about VIP is it is one of those hormones which is peptides which is secreted by ganglia in the gallbladder, in the sphincter, in the intestine. Rest of all the hormones, they were secreted by the endocrine cells of the stomach, of the GI tract, but this is secreted by the ganglia. So remember that. Now the factors that regulate VIP are very similar to the factors that regulated gastrin production. Okay, so whenever there is distension, okay, or there is vagal stimulation as it is given in first aid, there will be increase in the production of VIP. Okay, and the third thing is VIPoma, the tumor of VIP, tumor which produces VIP. Now, okay, the syndrome which is caused by VIPoma is WDHA syndrome, and this is really high. WHA syndrome. Okay, let's give it 5 star. What is the full form of WDHA? WD means watery diarrhea, H means hypokalemia, and A stands for achlorhydria. So definitely remember this. Try to make a question on your own in your mind regarding this. Okay, try to make a clinical scenario out of this, and that will definitely help you. Okay, so okay, yeah, also this is tumor of pancreatic. This is pancreatic tumor. Okay, pancreatic tumor from islet cells. Okay, but the islet cells are not alpha cell nor they are beta cells. Okay, another thing is nitric oxide. The only thing I think that is important for nitric oxide is whenever there is loss of nitric oxide production, then it will lead to achalasia. So whenever there is loss of nitric oxide production in the lower esophageal sphincter, then it will cause achalasia. This is one of the most important thing. Okay, now the last thing is somatostatin. All of you know that somatostatin inhibits the digestion. Okay, it inhibits all the hormones that helps in the digestion. Okay, and the main thing that you should remember about somatostatin is its use. Okay, treatment. The treatment, it is used for treatment of acromegaly. Sorry, I don't have enough space, but say it is used for treatment of acromegaly because it inhibits growth hormone. Okay, it is also used in carcinoid syndrome. And why it is used there? Because somatostatin decreases the production of serotonin from the tumor cells. That is the reason why it is used in the carcinoid syndrome. Also, it inhibits the product of serotonin. Okay, so that is why somatostatin is used in carcinoid syndrome. The third use is variceal bleeding. Okay, why is it used there? Somatostatin lowers the portal hypertension. It decreases the blood pressure in the portal vein.